what happened in New York. This was the largest body collection point in the history of the world. We've never had that many people. And for the States, it was definitely historic that we had that many people at one time dying to where we could not keep up. So it just collapsed the system. Funeral directors were overworked. I'd been into dozens of funeral homes, and I can show you pictures out of the New York Times where they're stacked up in their even in their chapels on chairs, from chair to chair. They've got them in a cremation box or any kind of board or box they can use to lay a decedent on, and they turn the air conditioning down to 65, and that's what they had to do to try to maintain. So funeral homes, coolers were overwhelmed, out into their chapels. ME was holding them for them, the medical examiner was holding somebody, but then they quickly became overwhelmed, and that's why the feds then came in to help. So massive, the planning and all that's involved to take care of that many dead at one time. And for me, COVID became very real. Hi, I'm Deon Strommer. I'm a funeral director in Balmer by trade. I'm also a deputy medical examiner or a medical legal death investigator. I'm a member of DMORT, a disaster mortuary operational response team. I'm a member of the Northwest response team, which is Oregon's DMORT team. I'm a deputy commander of the Oregon team, and I former owner of First Call Mortuary Services here in Portland, but I've been in the death care industry now close to 40 years. So we were burying 8 at a time, 4 and 4 right butted, toe to head. So we knew, but we knew the names, they were marked. So if we later, the option was going to be given to the families, if you want your loved one exhumed, we will do that at cost, and we'll go down to third level, pull them out, rebury. It was for the health and safety of the public. That's the reasoning. How do we control when the hospitals are full, the morgues are full, the medical examiner's offices are full. I mean, they have coolers that hold 500 people. We had them in hallways. We just couldn't contain what to do, and so they had already decided and purchased these warehouses in Brooklyn, right along the river there, that we were going to set up our morgue in. And once that drone flight went over, and the public, and it put fear and panic in the public, and I think no one thought about that. The thing was, we're the government. This is for the health and safety of everyone. This is what we're going to do. And they had such an outcry to the mayor's office and the governor. Pressure was put on that, hey, we need to halt this, come up with a plan B. So then the plan was, in one of those warehouses we rented, we brought in 160 freezer units that would hold 45 to 50 bodies, and we freeze those bodies for long-term storage. Because what we were doing on that same lot where we had the 3 warehouses, we had 90 acres, and we parked 500 refrigerated trailers. That's great for a time, but it isn't really for long-term storage, because we needed time for families to catch up. A lot of things were going on. The economic unsurety. You can't have a funeral, there's only 10 people. Well, we're going to wait till we can have a funeral. There's that, and then we realized, it's a long-lasting. Well, now we might not be able to have a funeral, so some went ahead with the funerals, but the crematories got backed up 8 weeks. The cemeteries got backed up 8 weeks. So we were falling behind each and every day. So even if it was at 800 and it reduced to 600 and 500 and 400 a day as it started to reduce, or how it built up, peaked a couple weeks, then went down, we could still only process. It took us 6.5 minutes to get a body off a trailer, run it through the system, the morgue. We would decon it, take a picture, because we work for the medical examiner's office. They have total control. So it isn't the feds coming in. We mean DMORT. We work for them. We're under their guidance. So who made that decision? It was the state and city authorities to mass bury. And we worked under them. We give them guidance and help. We took 4 or 5 National Guard personnel with a subject matter expert, like a funeral director. This is how you remove that person out of this bed. Well, not all apartments in New York have elevators, so you're using pulleys, you're carrying people down 15 floors. I mean, it's just intense, it's physical. It takes bodies to move bodies, and it takes a lot of people. I give credit to those young men and women who never been around this and now are asked to be around thousands of individuals that have died, and their mental health was important. So yeah, a lot of things going on, and I think they were pretty firm at first. No, we're going to mass bury. That's our plan. But the pressures was, okay, we've come up with this other, which had never been done. You know, I assisted on some autopsies. It turns your lungs to jello. You do not, I mean, it's a mean, and of course we have a better chance now of living than we did in the spring because they've learned how to treat some of it. Some people don't get the heavy strain as some of them. It's so different, but I just know the face of what I saw. I saw 35,000 body bags, orange body bags, and we put them in orange to heighten our awareness. When you're working every day, be aware this is a COVID positive case, and we did not know early on, like we didn't know with HIV and AIDS. When I got in the industry, can you catch it from a deceased person? The odds are pretty slim, we're finding out, but the virus still lives. So learning how to handle and do that, but we got it down where we could process a body in 6.5 minutes, but that's still only 200 a day when you're running 24/7. You know, unless you set up several morgues and you're trying to run more people. So yeah, pretty massive project. Proud to be a part of it. Had I not seen it, it's hard to believe. It was just so many decedents all at one time. Yeah. And we, as in Oregon, we've been following the University of Washington numbers. I sit on the state fatality management team, representative from the governor's office, medical examiner, state police. I mean, all the players are there, and our plan was to mass bury. A Cascadia situation, when you have the first science at 50,000 dead in the first day, towns are going to have to do it, put in potato sheds, they're going to have to mass bury. And that's what I saw at Katrina, Puerto Rico. People did the best they can. The numbers we're hitting now, we weren't supposed to hit them in Oregon until February. So we've been running about 4 COVID deaths a day for the state of Oregon. We normally have 100 deaths a day in the state of Oregon, so about 36,000 deaths a year. We've been having 4 COVID deaths a day up until November, and the model showed it was going to hit 8, and it hit 8 average for November. December was supposed to be 12 a day, January 18 a day, February 35 a day, and then we see it declining then in March. We've already hit 50 some a day, 26 a day, 41 a day. So we're having February numbers now. So are we going to in February be 3 times that? So we're having, if you think there's 100 deaths a day, and we have, the other day we had 51 or 56. We've already tripled the number of deaths that we normally have. If my math is right? I mean, we've just added, and it's not overwhelming, but you get an innate feeling or a gut feeling that, you know, everybody's busy in the death care industry right now. My cooler is getting backed up. So the question is, what do we do with all these bodies? So hospitals have pulled the trigger and brought in refrigerator trucks. Providence, Legacy, Kaiser, they've got refrigerator trucks. Contracted. Providence are bringing theirs in. The medical examiner, the Multnomah County has got refrigerator trucks. So does Clackamas County. They've not got anybody on them yet. They just have them in reserve. They're ready. We've added 36 spaces in my cooler. We're more ready now than we were in the spring. And I think part of that is my experience in New York. We had daily calls with our fatality management and the governor's office here in Oregon while I was in New York for those 3 months. I think we're more prepared than we were in the spring. If that had happened in the spring, we were not ready. Thought we were ready. Now we have some ideas. So plans are been in place. I think before mass burial, what we'll do is we would embalm bodies. Then you don't have to refrigerate them. Still takes a couple of hours to embalm a body, but we would not get families' permission. It's a government issued, and again, some religious groups, some families, they don't want that. But again, the governor would do an executive order, and we would be allowed to embalm bodies with no permission. And that's not as offensive as probably as mass burying. You'll see as you get a tour. I have room here. I can put people on shelves. I can, if they're embalmed and don't have to. The other is another executive order that they're looking at is that we would not have to follow the temperature protocols because it's cool enough. People could store in the garages. Funeral homes could store. So you're just looking at ways that we wouldn't get fined because they're not at 34 degrees. Right. It's okay at 40 and 50 degrees in the coolness of your garage. And in my area here, my warehouse, I got plenty of room if I can do that. But the other is to be able to embalm them. Then again, you're still limited to 10 to 25 people at a funeral. In New York at one time, you couldn't even get out of the cars at the cemetery. There was nothing at a church or service. It was just, you go to the cemetery, they're going to bury. I think this next year, when they're all vaccinated, I can just see all the memorials that people are going to be invited to. Yeah. I mean, we lost an employee here. that from COVID, and
Sorry.
and it really touched home and made it real. We see it every day. My people see it every day, and to follow the protocols with their PPE and to be safe for them, safe for their families. I give all the credit to doctors and nurses who are frontline workers. We're that back group that aren't thought about, and that's okay. But we're dealing with the same type of thing, and we see the end result of COVID every day. I mean, we're reaching the numbers that were lost in the Civil War. I mean, it's and to me those numbers. I mean, people don't pay attention. We have what is it? 700,000 people die a year of cancer. We have 500,000 people die a year of heart attack. Stroke was the third leading cause. When COVID reached over stroke, then it was creeping up on that 500,000 mark. Will creep up on heart attacks, but then again, heart attacks and stroke are up. But my theory on the numbers, you take the last 10, 15 year average of deaths in the U.S., and I think it's 3 million a year or something like that. And then you add what 2020 death rate was. And any increase, to me, is COVID or COVID related. It has to be. Even though some may say heart attack and stroke, to me it's somewhat COVID related. It'll be interesting to see what the numbers are. I live in a very conservative part of the state where they're anti-maskers and they're making those numbers. Hospitals get money for every time they put a COVID death. I don't know that end of it. All I know is what I saw in New York, where they weren't counting the home deaths. They later adjusted that by 4,000 and did add the COVID in, or probable COVID, and it becomes political. After any disaster, and you watch it in the future, Jack, the first couple of weeks, taking care of the living and the injured, that's important. That was the thing we had at Katrina. But then it becomes a political hot potato. What are we doing? They even got my mama out of the house. And we were months recovering the dead out of Louisiana, and they wanted to get the city back open, and we hadn't been to all the homes yet. And I actually had a morgue operations manager for Katrina. I actually had a family bring to the gate of the morgue their grandmother wrapped in a shower curtain when they returned home to her home, and there she was. We hadn't gotten there yet. It gets so political. We would get there. We were trying to get there, and then they wouldn't let us in the Ninth Ward. The Ninth Ward was so political. The mayor would not let us in. He was holding out for more dollars from the feds, and there was 2 different times we were loaded up in caravans to go into the Ninth Ward to remove the body. We had an estimate of about 600 dead in the Ninth Ward, and they pulled the plug on us, and so we never got in the Ninth Ward till March. This happened in August. We didn't get in the Ninth Ward till March to remove those dead, and it becomes political after 2 or 3 weeks. What are we doing with the dead? Be it a tornado, any of that disaster that goes through, a cemetery washout, which a lot of people don't think about when we have all this flooding and hurricane. You had caskets popping out. There's enough air in a casket that's sealed that they'll pop out. Sometimes they float away. I've got pictures of a casket 50 miles away in the storm surge from the nearest cemetery. It's up in a tree with a freezer. And it was just bizarre to me to come on that out of the swamps. But I still think us getting in groups, probably 2023. I mean, could I feel comfortable going to a state fair? Could I get, those kind of things I love to do, to be around people? I don't know. Hopefully we'll start feeling a little more comfortable. And then this other strain out of Britain, reports last night, scary. It's almost deja vu of what we first heard last January. I got my first email January 30th last year to see if I would be able to travel the next day to Travis Air Force Base to help with the quarantining of the Wuhan China group. And so I left January 31st. We took the first load of repatriated citizens that February 1st. And those people, again, dual citizenship, some of them, but American citizens, I mean, they just kissed the tarmac. They were so happy to be home. And we didn't know a lot about COVID. I mean, I physically had physical contact with 1,500 potential carriers of COVID. What I mean by that is that on Air Force bases, they don't have jetways. They have the stairs, and you have to help people down these 3-foot stairs. You're very close. A lot of elderly on cruise ships. That's the next thing we did was a Japanese cruise ship, the Oakland cruise ship, helping them down. Wuhan China group, we had 70 kids, 4 and under. They had to be carried down. Of that 1,500, 400 became sick, and 8 died. So I knew I was right next to it, but again, you're kind of the canary in the coal mine. I mean, the CDC doctors we were with were they trained us, and the reason they had DMORT, the mortuary team come, is because we knew PPE. We knew how to wear it. We're used to wearing it in our jobs. Didn't take a lot of training. And then we know how to work with upset people. A lot of these people didn't know when they got to the States they were going to be an automatic quarantine. They thought they were going to be quarantining at home. They didn't realize that we had set them up and in motels, but other base housing, and they had U.S. Marshals, and they weren't going anywhere. You couldn't go to the store. You couldn't go for 2 weeks. You were quarantined. So they relied on us for their food 3 times a day and having their temperature checked twice a day. We were their only contact, and you got to know those people really well. And then when their temperature started to go up, as soon as you see it pop a half a degree and then a degree, you knew that they had it, and it was just then we had to take them to a hospital, and then they knew that someone would go back, and it was so many sad stories of one lady was on a cruise ship and on the Oakland cruise ship group, and kind of dementia, was with her husband, and he could kind of help them along, but once he went to the hospital, then she's left alone, and we did not realize her condition of somewhat dementia until we would come and give her her food and see that she hadn't dressed or showered or probably haven't even been in the bed, and so we realized, okay, we have a problem here, and then we were able to bring in nursing help and some other things, but it was just, we thought we could contain it. We didn't know that it was already here, and then we had 30 other cruise ships on each coast, and then finally by end of March it was here. We just opened it up. I mean, there was nothing that we could do. I think the plan was good to try to contain it, what we knew about it. So to me, that's deja vu of what we're hearing coming out of Europe. We heard those first inklings in January about this disease in China, and then we're going to bring some from China here. We're going to try to contain it, quarantine them, and then all that is developed. And I know they're not poo-pooing. They're trying to settle us on this other strain. But man, when I heard that last night, it just felt defeated. Like, oh my gosh, do we have another year or more of this? Talked to people. I've had friends that have gotten it in their 70s, and I worried about them, but they've had very mild. And then others, like an employee who was 55. And he had a hard case. In 5 days, he was dead. I mean, it was just so. I don't know about it, and I would think I'm healthy enough. You hope to be able, but we take all the precautions, and you don't know. But families are ready. This season, Hanukkah last week, my daughter-in-law and their family. You just want to get together. Christmas coming. It's I've got family that's coming, and what am I to tell them no? Kind of thing. I mean, each family makes their decision, and you try to be safe, and you get tested and do the things. It's a crazy time. I wish my grandparents who went through the 1918 had left journals or left notes to what they went through, because now we're learning more about it. I mean, you kind of heard about it, but didn't realize. They were given tickets. I had a friend who his grandfather left a journal and said that he was ticketed $5 for not having a mask. So I think it's important that we journal this and leave a little history for 100 years from now. I'm hoping this is a cycle that is 100 years and not continue for several years here. But I think we're for a few years. It'll take a while for us to get back to normal. I think it'll eventually come. But when you got in the death care industry, I enjoyed helping people through a difficult time, to help shepherd them. We call them funeral directors. It's kind of like directing a play. You're directing. To me, there's no more satisfaction than when you anticipate a family's need. They're coming out to view the body. You take them by the elbow. You walk them up, and just so that no one's like, what do we do next? To me, it's having. You have the soloist, the organist, the minister lined up, the pallbearers, everybody, and it's a play that you're putting on. And when a family puts an arm around you and says they appreciate everything that you've done for them, I don't know if ministers, rabbis get that kind of satisfaction, but there's a lot of satisfaction. Now you move to your question of with COVID. It was different. Again, quarantine we had never done. You got to know these people. I'm still in contact. I text and emails. A couple of dozen of people that I've met, and one couple never saw this coming. I was at Dobbins Air Force Base in Georgia for the Oakland cruise ship. There was a couple, Bob and Lucille Jacobson from Brooklyn, New York, and they reminded me that I said when they were leaving that it was an honor to take care of them. We got to be really, really close. We would talk outside the fence, or they would be on one side and I'd talk, and then I'd deliver their food and that thing. Those things, but we got to know each other and thought that was our final goodbye. Hey, we'll see you. Let's stay in touch, kind of a thing. And then I got home for one day, and the next day I went to New York, got orders to go to New York to help with the medical examiner's office there. Well, I eventually was stationed first Manhattan, then went to Queens, and then got stationed in Brooklyn, and then I was assigned to be the morgue operations manager and deputy commander of the operation for DMORT. And it happened to be in Brooklyn, and so I let them know, hey, they're moving me, I'm moving hotels to Brooklyn. And anyway, so they said, hey, could we come by to see you? I said, my days are 12-hour scheduled days, but usually I work at 14 because of morgue operations. And so, I kind of tried to brush them off, and then they just said, well, we have a little something for you. So anyway, they came to the motel where it was. We met in the lobby. We elbowed bump, and they said, you said, sorry, you said it was an honor to take care of us when we were in Georgia. We want to take care of you. So they brought me food for a week that I could put in my refrigerator, and that I could heat up in the microwave for lunch and dinners, and it saved me a ton of time. I didn't have to go out scurrying for food after work. I mean, I had it, and every Sunday for 3 months they brought me a week's worth of food. It was we, like I said, a friendship developed, people I never knew before, and I don't even remember saying it was an honor to take care of you, and then we were here to take care of you. Just to have that playback, I try to let them know. I don't know if they'll ever know how much that meant to me, because of the emotional toll that whole thing. This is probably some of that PSD. I mean, it's a tender story, but there's some PSD. I actually had to take a knee. I've been doing this 36 years, almost 40 years, and I think I've seen it all. Even as a death investigator, I'm still surprised. I can be surprised when I go on a death scene and go, how did that happen? How did you get yourself in that? So I know I can be surprised, but I was surprised at the emotional toll, the mental toll that 35,000 deaths took on me. I got to where, I wasn't sleeping well. It just the sheer amounts. You can't. I mean, the number is almost. When you talk tens or hundreds, okay, people can relate. It's almost unrelatable number. 35,000. It's like. It until you see that on 90 acres parked, and you open those trailers and there's 75 bodies on racks, and man, it just brings it home, and that day after day, and that's why I can't imagine those National Guard. And we checked in with them. We had a lot of mental health people, and I wouldn't take, how you doing today? Fine, sir. They were very military etiquette. And I said, no, you tell me how you do. Are you sleeping okay? Are things going? And I finally I had to take a knee. I had to take some time, get my head wrapped around, and get back in the game. And that surprised me. And so you can still get post-traumatic. I realized that self-care, very important. Very important. I'm glad I recognized it, was able to go to somebody I knew and talk about it, and that's why even processing it as we talk today, I'm still processing that. I got home and went to my property in Baker City, and I just cut wood, cleaned up, I built fence. It took me 3 weeks to get my head out of New York. I wanted to know every day what was still going on, and my contacts, and how the people were doing, but before I could get back. And I had that after Katrina. I had a little bit of it after Puerto Rico, just not that long. Usually a week I can, you adapt back to your family and all that's going on. I have a loving family, very supportive and all those things. But New York was real for me from the very beginning.